Good morning. I'm Alan JETTE, and on behalf of Dr. Frank Lynn, my co-chair of this workshop planning committee, I'd like to welcome everyone to the workshop on hearing loss and healthy aging. This workshop is being hosted by the IOM Forum on Aging, Disability, and Independence, which I also co-chair with my colleague, Dr. Jack Rowe. This forum focuses on key problems and strategies at the intersection of aging and disability. Our forum offers an ongoing neutral venue where stakeholders in government, academia, industry, foundations, and consumer groups can come together to discuss issues of mutual interest and concern, such as age-related hearing loss. We have many sponsors of our workshop today, and I just want to take a moment to thank each of them. In addition to the forum, we have the Academy of Doctors of Audiology, the American Academy of Audiology, the American Speech Language and Hearing Association, the Cochlear Americas, the European Hearing Instrument Manufacturers Association, the Hearing Industries Association, the Hearing Loss Association of America, High Health Innovations, Med-El Corporation, USA, the National Institute on Aging, the National Institute on Deafness and Other Communication Disorders, and the Sound World Solutions. We're delighted and really appreciate the support of each of these organizations. And in particular, I also want to thank Contacta, Inc., who've provided the hearing loop system that we're using for the workshop today and tomorrow. Now, this two-day workshop, in addition, I also want to thank the Planning Committee, whose names are listed on the back of your agenda, who put together this two-day workshop. Now, in terms of our objectives for today and tomorrow, first, our intent is to try to describe and characterize the public health significance of hearing loss and the relationship between hearing loss and healthy aging. In addition, one of our goals is to discuss the range of hearing needs and rehabilitation strategies that are available. We want to explore innovative technologies and look at barriers to their development and their use. We also want to identify areas of needed research going forward, both short and long term, and consider collaborative strategies that can be adopted for improving awareness of age-related hearing loss and intervention strategies. Now, in general, over the next 2 days, if you've looked at the workshop schedule, you'll see that the workshop is comprised of a series of panels that we've put together. After all of the speakers in each panel have given their formal presentations, there will be a joint question and answer session, during which time members of the audience may pose questions for the panel to consider and discuss. And when you have questions to ask, we would ask that you use one of the microphones around the room. Now, I've been asked to give an important announcement so you understand the role of IOM in National Academy workshops. Unlike other IOM panels, this is a standalone workshop. It's not part of an ongoing study by the IOM. A summary of the presentations and discussions made over the next 2 days will be prepared, and it will be done in accordance with the institutional policies and the procedures that will be published by the National Academies Press. The summary will be broadly distributed, and it will be made available to the public. We should note, however, that all the views presented over the next 2 days and the report that will be published represent the views of the presenters, not any particular agencies or organizations. The report will not contain findings or recommendations, unlike other IOM study panels. So workshops are different than some of the more traditional IOM study panels. I've also been asked to highlight a couple of housekeeping announcements, which I will now do. First, I want to mention that we are webcasting the workshop. In addition, we're now on Twitter, and our hashtag is number IOM hearing loss. So all you Twitter fans can join in on Twitter. The webcast will also be posted onto the workshop's website and the website is listed at the back of the agenda. I've already mentioned that if you have questions or comments that you want to make, please approach one of the microphones. Slides that are being presented today and tomorrow will also be posted on the websites for people to review. And we've put together detailed speaker biographies. They're available as handouts, and because of that, we will not be giving lengthy introductions so that we can really preserve the time for presentation and discussion. So I will now turn it over to my co-chair, Dr. Frank Lynn from Johns Hopkins University, who will provide some framing remarks for this workshop. Thank you and welcome.